Hi, everyone. TJ Alds of I-45 Now, Galveston Now, and Pod Now. Welcome to another edition of What You Need to Know with Dr. Philip Keiser. And the star of our show you see there at the bottom of your screen, the CEO of the Galveston County Health District, as well as the local health authority. And also joining us today is we've talked about her getting the job, but first time on the show with us in her new capacity is Amy Cotharn. She is the new Chief Operating Officer of Coastal Health and Wellness. Amy, thanks for coming on board with us.
Thanks for having me.
We should point out that Amy's going to be talking about the Back to School Bash that's going to be happening this weekend. And then we're also going to talk about, with Dr. Keiser, monkeypox as well as COVID-19 updates. We should point out, speaking of COVID-19, both of y'all recovering from COVID-19 right now. So let me just ask you, how are y'all feeling?
Go ahead, Amy.
I feel well. It was nice and quick, and overall, I think recovering quickly. So I can't.
You're vaccinated, double vaccinated, everything you need to do there. Dr. Keiser, about with it. It was eventually going to get you at some point.
Yeah, so I got sick on July 4th, and on the 5th, I started taking Paxlovid, and I by the end of the week, I felt much better, and my antigen had turned negative. But by the next weekend, I started feeling sick again, and it felt really, really bad for about another 10 days, and ultimately last week went and got an antibody infusion. And then was able to feel much better. So I feel pretty good right now. But it was a long haul. And it was surprising to me just how tired I felt. More than anything else, the fatigue was just overwhelming at times.
That's what I'm hearing. A lot of folks now, what they're dealing with is not the cough so much or anything like that. It's just they just don't want to get up and move on that. We'll talk more details about that because you brought up two things within there. I think we'll talk about more on COVID-19. Okay. So Dr. Keiser will join us back here in just a little while. But Amy, let me chat with you here real fast about a fun event coming up this weekend. It is the Back to School Bash. In last year, kind of limited in how we did it as a drive-through event. Tell us about what's going to be happening this weekend.
Yeah, so we're super excited, TJ, to be able to host it on site in the clinic and also in the public health building. We'll have resources set up throughout both buildings for folks to come. So it's this Saturday, July 30th, from 10 to 12. We're prepared to serve over 1,000 students with backpacks and school supplies. We do ask that parents bring their students with them on site. We have we'll have fire trucks available to tour, ambulance available to tour, helicopters, lifeline, raffles, prizes, raffles for sports physicals, immunizations will be available for all children and up to about 18 years old. And we're looking forward to a great time. You know, last year we did it and we were amazed and ecstatic about the turnout. So we actually had a second follow-up and it was a drive-through. So this year we're very excited to have it on site.
One thing you talked about, the immunizations will be available there. It should point out to folks that while those are available, they're not free. There is going to be a cost. Can you explain that to folks before they show up so they can?
Correct. Yeah. So we have a full service immunizations clinic here in our public health building. And there is a fee associated with immunizations, but there's no appointment necessary. We have all immunizations available for school agers. We have measles, mumps, rubella, varicella, meningitis, Tdap. So they are here and available. And typically you get in and out pretty quickly.
And talk about that because you said up to 1,000 folks can come on out, 1,000 students to get their supplies out there. Where are you getting these supplies? Do you need some more donated? Because as you said, we ended up having to do this twice last year because the first batch went away in like 15 minutes last year.
You were here with us, TJ.
Yeah, I was. I remember that.
It took longer for folks to line up than it did for the backpacks to go. So we're always looking for donations. We have some very generous and amazing community contributors, as well as employees, Health Center and Coastal and Galveston County Health Center employees contributing. But we'll have a little over 1,000, but we are still accepting. And if we have to do a second run at it, we'll most definitely do that again.
Yeah. And so if you do have some items you like to donate, or even one of the things that's good, bring in like a gift card to where they can get supplies at, like backpacks and the like. Bring it by Coastal Health and Wellness's offices. It's 9850 Emmett Lowry Expressway in Texas City. And of course, that's where the event will be on Saturday as well. In talking about immunizations, it's back to school time, and this is I don't want to say it's our first kind of regular return to school, but in many ways it is with that. So some folks may have forgotten what's required here to do that. What all type of immunizations? There's a list that are mandatory by school, and we should by state law. But we should point out COVID-19 is not one of them, even though it is available.
That is correct, TJ. Yes, and you can go to our website and see everything that we have, and the schedule of which immunization should be given at what ages. COVID-19 is available, the vaccine. It is not one of them. However, we have it as well. It
is available there. And how's the response been? And we know that parents are somewhat hesitant, while even though they themselves would get the vaccine. But now that it's approved for youngsters, from infants on up now, or very young and on up, that they can get the COVID vaccine. How's the response been at Coastal Health and Wellness? Because in many cases, the population that you serve at Coastal Health and Wellness is the one that must be underserved in getting any type of immunization, particularly when we talk about COVID-19.
We've had a really positive reception to the COVID-19 vaccine for pediatrics. We are constantly filling appointments. Our pediatric appointments have actually nearly tripled in the last 6 months. And so I would say that the turnout for Coastal Health and Wellness has been extraordinary and continues to shine and push through those obstacles or
Right. And forgive me, folks, if you hear the background, I'm actually working from the home office today. And as you can hear, the dogs have decided to talk to someone in our front yard that's out here today. The back to school bash too, you're going to be having, you said, we can get folks signed up too for their sports physicals. That's a big thing for a lot of those kiddos that want to play football and volleyball and soccer and the like. You can get the sports physicals. How's that going to work?
So it'll be a raffle system. Just truthfully, a sports physical can take anywhere from 25, 30 minutes up to, 45 minutes or longer. And we want to make sure we do justice. So there will be a raffle for the sports physicals. We'll raffle up to 20, and they'll be able to get the sports physicals on site free of charge. And then we'll also have registration available at Coastal. So if you don't have a medical home, you can get registered and we can get you an appointment.
In those sports physicals, the old days they were required and kind of go through the paces. But nowadays we're finding more and more with those sports physicals are actually catching some things that are serious. That everything from heart conditions to other things to which youngsters need to go get treated for. Particularly, again, when we're talking about a population that may not have regular doctor visits and the like. And so can you talk about how important these are? It's no longer the days of like when I went to school, you went to your physical, you got your knee bopped a couple of times, get your heart listened to, and you were kind of done. And it was signed off. It's actually more thorough nowadays than it used to be.
It is more thorough. That's why we, mentioned wanting to give plenty of time to the providers to spend that one-on-one time with the child and their parent. It's a very thorough assessment. It's equally as important as an annual assessment. And like you mentioned, TJ, that is the platform in which you can really capture something that might be detrimental to that child once they're engaged in sports. So not having it or rushing through it is definitely not what we want to do, because it is such an important appointment.
For those of you just joining us, this is What You Need to Know with Dr. Philip Keiser. And also joining us today is Amy Cotharn. She is the Chief Operating Officer of Coastal Health and Wellness. Also joining us on the here in a little bit will be Dr. Philip Keiser, the local health authority for Galveston County and the CEO of the Galveston County Health District. We're going to come back with both Amy and Dr. Keiser right after this word from Coastal Health and Wellness.
Hi, everyone. My name's Amy. I'm with Coastal Health and Wellness. I'm here to tell you about this year's back to school block party. Coastal Health and Wellness, in partnership with Galveston County Health District and ARC Pet Allies, are partnering to throw the Back to School Block Party. It's on July 30th from 10 to 12 here in Texas City. We're offering free school supplies while they last, but remember to please bring your children to pick up these school supplies. We will also have free giveaways, prizes, raffles for free sports physicals, and much more. We'll also have resources like WIC, SNAP, and you'll be able to get registered for our clinic here at Coastal Health and Wellness for your primary care and dentist needs. All ages welcome. Please join us at 9850 Emmett F. Lowry Expressway, Saturday, July 30th for our Back to School Bash. If you need more information, visit us at coastalhw.org. See you then.
Look good there, Amy.
That's a much better Amy than today's Amy.
Well, that Amy was not recovering from COVID at the time.
Right.
So, one of the things that's said in that I think is important too is there's a resource, and I'm having you on, and I know Philip, you'll back this up too, in Coastal Health and Wellness for overall healthcare. And one of the things that Dr. Keiser and I have talked about for the last 2 years in dealing with COVID is so much folks talking about COVID, so much focus on that a lot of standard care, just going to your doctor, was interrupted by procedures in there, and then folks themselves got out of the practice. Can you talk about the services? Because you say in there, come and sign up with us. That's one of the great resources of this event Saturday. Yeah, you may get a backpack for your kids, but also why don't you go ahead and sign up and get the healthcare that you need as well?
Yeah, definitely. So, Coastal Health and Wellness, if there's any one takeaway I could offer here is that we are a primary care provider, but we aren't just that. We offer full dental services. We offer behavioral health counseling, and we have an in-house lab. In addition, we have some of the best providers in Galveston County. But we don't just serve any one population. We serve across the ages and full spectrum. So it's a place that you can bring your entire family, from pediatrics all the way to geriatrics.
And it also, some people may have the thought of, oh, I only need to go there if I don't have insurance or anything like that. That's not true either.
No, we accept all insurance. I'm a patient here. I love my provider. No, we accept all insurance. And I often joke, Dr. Keiser, our providers are phenomenal, and they see a full range of patients and types of patients and issues. So they're very well versed, and insurance or no insurance, yeah, we're here.
And that's the thing too. If you don't have insurance or you have signed up for that you have caseworkers there, they can help people get signed up as well. Going that, and it's a solid resource to have in the county, is it not, Dr. Keiser?
Oh, it really is. I mean, it's something that we really feel is integral to our whole public health system. Not only do we want to prevent disease and inform people of ways to better their health, people need a place to go. And unfortunately, during the pandemic, a lot of people lost their jobs and had difficulties. And so we've been able to help provide healthcare to those individuals who don't have any other place that they can receive healthcare.
Well, Amy, thanks for coming on with us. We're looking forward to seeing you Saturday, 10 until noon out at 9850 Emmett Lowry Expressway in Texas City. It's the Back to School Bash. We'll be out there live right beforehand and a couple of times during the event. And not only just the school supplies and the drive-through thing is gone, right? People can actually come inside.
Yes,
and
we're excited.
Out of the heat.
Right.
Come on inside and enjoy yourself there. Prize giveaways, some fun and games there as well. So we'll be out there. I-45 now will be out there as well Saturday, and we want to see you out there. Amy, thanks for coming on with us. We appreciate it.
Thanks for having me, TJ.
So Amy Cotharn, she is the Chief Operating Officer of Coastal Health and Wellness. She's been on with us here today as well. So thanks a lot, Amy. We appreciate it.
Thank you. Take care.
All right. And now we get into, as always in our show here, Dr. Philip Keiser, the CEO of the Galveston County Health District and our local health authority. Let's get right into this here, Dr. Keiser, is that we are seeing a spike here. And again, as we always say when we do this program, we're only bringing out the numbers here not to panic anyone or think the world is ending, but the number of active cases right now, 3,500 folks that we know of, and that's something we need to talk a little bit more about, are positive for COVID-19. Now, a high number of folks, but as compared to last summer, that number doesn't tell the whole story. And wanted to give you a chance to talk about it, because as what we're finding is, yes, more people infected right now, but they're not getting as sick, not as many in the hospital, and obviously not nowhere near the death rate that we would have, even though it's always been low.
Yeah, so the numbers have been rising very steadily, but I think if anybody just talks to their friends and family, it seems like COVID is everywhere right now, and they're right. And so what we typically show on our website are those people that have had a PCR test, and that's been done at a hospital and then gets reported to us. But many people are using home antigen tests. I've got one right here, and those tests don't necessarily get reported to the health department. So we're underestimating the amount of COVID that is out there, and we know this. We actually have started looking at a different metric of people that have either had a positive PCR test or had an antigen test, or people that have been reinfected. Because typically what we do is, the way we count these things is that the first time you get COVID, you're counted as a case, but the second time you're not counted again. And there are reasons in epidemiology why they do that, but that just kind of skews our data right now. So when we add all those together, we're really seeing about twice the numbers of COVID in our community than what we're seeing right now, than what you see on this webpage right now. So there's a lot of COVID out there. The BA.5 is very, very infectious, and everybody seems to be getting it. That being said, the number of hospitalizations has not risen to the same degree as the number of cases have, and that's good news. And in addition, we're also seeing people are not staying in the hospital for as nearly long a time as they have been. So rather than coming in the hospital and spending 3-4 weeks, people are coming in and spending a few days in the hospital and then being able to go home. The last thing is that when we look at the number of people that have died, that number is actually quite low compared to what we have seen in the past. In the past 3 months, we've probably had about 10 or 12 people die. And if you think back, in the middle of last year, we had some days when we had one day where we had that many people die. So, clearly the disease is changing, and clearly our ability to respond to the disease is changing, and that we have a lot of medications and therapeutics to help make people better, so that they're not getting in the hospital and they're not dying.
And to put that in contrast, is there are 28 people, Galveston County, in the hospital now because of COVID.
Right.
That if we'd had 3,500 active infections before, let's just say early 2021, that number of 28 would be much higher at this point.
Yeah, probably see about 70 or 80. And it just compared, last year this time in July and August, I think UTMB topped out with about 200 patients in it in all their hospitals, and and now they're running about 70 or 80 people. The other thing is that, we also count admissions. So that is number of people who get put in the hospital. This what we're seeing right here is a census, how many people are in the hospital right now. But if you look over a week's time, you'll see that we have, roughly about 30 people in the hospital, but we have had about 60 people go into the hospital, right? So what's that mean? That means they're going in, they're staying a few days, and then they're coming out of the hospital for the most part.
Which is a far cry from what we had early on, obviously. And that's where I guess the best term here is to point out some kind of factual data that's positive in this, is that for all the hand wringing by people and accusations by people that, this is all a farce and everything else. Mm-hmm. Here's an argument could be made here. When you look at the comparative numbers and compare apples to oranges and what's different now, you brought it up. Vaccines, treatment plans that are different now, treatment medications that are different now, and therapies that are different now. Mm-hmm. That this is what the end goal, not end goal, but this was the end goal of all the processes early on, was let's get to this point where it's manageable and doesn't overwhelm us. is that a fair assessment of what we're looking at here right now?
Yeah, I think we're getting there. And, I'm not ready to say that we'll never be overwhelmed by this, because this virus keeps throwing us curveballs. And just when we think we've got it licked, it comes around and does something different. But clearly, we're in a different phase now. And I think the vaccines have helped an awful lot, even though people are getting it. I've been vaccinated and I got COVID. But I didn't end up in the hospital, and I didn't end up, on a ventilator. And I think that's where what we really want vaccines to do. And in addition, I took medication. I took Paxlovid, and that helped me feel better as well. So I think we have a lot of things that are available that we didn't have available to us 2 years ago.
Paxlovid gets a little attention here too. Mm-hmm. In that, President Biden, who tested positive for COVID, that's what he has been on. Can you tell folks how Paxlovid works? Sure. What's the regimen on here? Because someone was calling me up today, says it's 40 pills. I have to take 40 pills. And well, yeah,
is it 40 pills? It's like 3. It's not quite 40. It's 6 a day times 5 days. So it's 30 pills. Right. There you go.
Right.
So Paxlovid is an antiviral drug. It's actually a combination of 2 drugs that are designed to kill COVID. And it was designed specifically for this virus. And these medications, you have to take 3 pills because it hasn't gotten refined enough yet in terms of our ability to make the pills all nice and neat into one single pill. But you take 3 pills in the morning and 3 pills in the evening. And most people, 85-90% of the people, feel better after taking this medication. It reduces the death rate by over 90%. And reduces the hospitalization rate by over 90%. The biggest downside of the drug is that it tastes bad, and it leaves a funky taste in your mouth. So I walked around for 5 days going like, you can't quite get that aftertaste out of your mouth. But that's the biggest downside of the drug. It does have some interactions with some of the other medications, so you really should, your doctor or wherever you go to see it, they're going to check what medications you're on to make sure that you're not going to be on any drugs that will interact with it. And if there are drugs that have interactions, there are some alternative drugs which don't work quite as well, but are a little easier to take, and we can prescribe those drugs instead.
You got me right there when you said it doesn't taste good. It reminded me of my grandmother's old line of, that's how it's working. Which I never believed that back then, and I still don't believe it now necessarily. But it goes to the next question, as I'm going to ask, is the future of treatments and future of vaccines in dealing with COVID in particular. Yeah. And we'll come back to look at some of these numbers here. But talking to Dr. Patel from UTMB Health last week, in our monthly show with UTMB Health, the interesting thing is that the work that's being done on this kind of combination shot possibly coming out that's flu -COVID, but the big part of COVID is the more effective vaccine is the term that gets used around a lot of being able to something that's a little bit better against the variant we're dealing with right now.
Right.
On those. Where does that all stand? Because there are some people who may think, all right, it's time for me to go get a shot. But are like, well, should I go now or should I wait until the better vaccine comes out? I don't know if it's going to be out in the fall or not.
Right. Yeah. Go now. I mean, that's the best advice we can give you. It's full steam ahead on these on the new vaccine that they're saying is going to come out in the fall. But we don't know what's going to happen with this. It's building a vaccine is not like building an airplane, right? People know how to build an airplane or a bicycle. It's pretty clear. The problem is anytime you deal with the human body, there's always that unknown about how it will react and what the responsiveness will be. So we don't know whether they're going to run into any glitches. We expect it to be pretty smooth because they've been doing this now for a couple of years and they've really gotten the process down very well, but you just never know. And so we don't know if there's going to be a snag in the development. The last thing you want to do is to be sitting around and waiting for the new vaccine to come out, let your immunity wane, and then get COVID. That's the last thing you want, particularly if you're at high risk, if you're older, like me, or if you're, you've got some other underlying health conditions which would make you at risk. You really don't want to do that. So, every adult should have had at least 3 vaccines. And unfortunately, most adults have not. And so it's very important that people go get that vaccine with the recognition that you're probably going to have to get another one come the fall.
Right. One of the things I'm talking about the effectiveness of the vaccines and one of the things is now there's one thing about research data that was gathered while the vaccines were being made. Now we're seeing real world data come back.
Yeah.
And Dr. Anthony Fauci had pointed out, and a lot of other experts have pointed out that the effectiveness as far as of the vaccines, not from severe illness. I should point out that it's about more along the lines of getting ill more than severe illness, is not as long-term as originally thought.
Yeah, that's right.
Because they're seeing it in the real world. However, it is still showing to be just as effective in severe health issues.
That's right.
As originally thought. Can you explain why there's a difference, or why one would change and why the other would not be?
Sure. So let's go back and talk about what were our initial expectations with the vaccine. When the vaccines were first coming out, we were hoping that if it's 50% effective, meaning that it prevents infection in 50% of the people and reduces death rate by 40, 50%, that would be really great. It was out of the ballpark. No one expected that we would have over 95% effectiveness in terms of preventing death, hospitalization, and even illness. So that was just shocking. But so in order to understand how vaccines work, you have to understand a little something about the immune system. We have 2 parts to our immune system. We have antibodies on one hand, and these are the things that grab onto bugs and kill them. And then we have what's called a T cell response, all right, or a cellular response. And these are cells that can go attack viruses and other things, eat them basically, and kill them and destroy them. And so what we believe is going on is that over time, the antibody response goes down. All right. But the T cells, they're part of what we call our memory response. So even though the virus may get in your blood and that antibody isn't there to clear it right away, the T cells then wake up and then they go attack it. And when that happens, that's where you would expect exactly what we're seeing, that, okay, we're going to see more people infected because we don't have that first line of defense of the antibodies. Well, actually, it's in our nose and then in our bloodstream. That isn't as good. But those T cell responses seem to be very robust and last for a long time.
And that's the part that's keeping you out of.
And that's the part that's keeping us alive. That's exactly right.
And where else do we see that kind of example? Whereas, okay, you're sick and that's what I was trying to get to.
all over the place.
Almost every single time a vaccine, this is kind of the effect. It really is. It's more effective if you have it, if you get sick, flu being one of them. But it also, what it does, what it's really good at, because you've done the flu shot every single year, is you're not going to the hospital with flu that develops into pneumonia or something like that.
Yeah. I mean, a classic case is the Hepatitis B vaccine. That's been around for over 50 years. And so when they first started testing Hepatitis B vaccine, they tested it among populations that were at high risk. And I had a friend of mine who was working at the CDC at the time, and he was working with some Inuit up in Alaska. And they had vaccinated everybody. And sure enough, their hepatitis B rates went down to nothing. And then about 10 years later, they were asking, well, we haven't gone in, we haven't boosted any of these people. What happens if we give them a booster? So they just went and they gave them just a little bit of the vaccine. And immediately the antibody levels came up and the T cell responses came up. And so their bodies remembered, and they were still protected from hepatitis, even though if you were to measure the antibody in their blood, you wouldn't find any. So, so our immune systems are pretty robust. And the fact that they have memory is, I think, one of the most important things that helps protect us.
And again, we've talked about this a lot. And this is where I think the political conversations got in the way of the medical conversations.
Yeah.
Granted, and you've admitted that there are times that the medical guidance on certain things to do went a little more heavy-handed than we would have liked. But you used the analogy earlier of building an airplane. But when you're trying to build the airplane as you're flying, sometimes you're going to make a mistake.
Absolutely.
But as along the way, I think their lessons are learned. And if anyone has watched the show, you'll hear the same from us of, okay, both of us, we take things a different approach than we did a year ago, and specifically way different than we did 2 years ago.
Yeah.
Along the way. The other question to ask on COVID-19 is that now that I consider really maybe May of 2021 is when vaccines really started rolling out. I mean, we know it rolled out in December of the previous year, but it's really where it starts going to the general population more May of last year. So we've gone, around 14 months now of having vaccinations done, boosters coming along the line here. Now that we've gone into that here, how effective do we say with that course has happened in that year in 2 months, as far as vaccines becoming part of understanding them better, knowing how we can take different approaches and the like, and knowing how to make them even better. As we talked about last time, and Dr. Patel and I talked about last week, we have the new protein-based vaccine that's been introduced now, where versus an mRNA, which may some people feel comfortable with. But can you just talk about the progress we've made, and now of making this? All right, we've gotten past the quote unquote emergency stage of this. We're now into the working stage of treating this and combating it.
Yeah. So, particularly with the vaccine development, I mean, like I said, it was, this was, to put it into perspective, this was like what the country did during World War II, and the response and the technology that went into the development of the atomic bomb and all the other technological developments that came out of that. And so it was really very, very remarkable that we could get this vaccine. But now that we have the vaccine available, we've learned some, like I said, some very important things about it. We learned that not all vaccines are created equal. Remember, a lot of people wanted the J&J vaccine because it was only one shot, and
not mRNA, right? Yeah,
right, and wasn't mRNA. And then what did we learn from it? Well, we learned one, that you did need 2 shots, and 2, that it wasn't as effective, and 3, that it could actually cause clots in people. And so now we really don't use that vaccine. And so what we're seeing now with the protein-based vaccines is that's a very traditional, tried and true method of making a vaccine. But you can also see that tried and true method took a lot longer to get that product to market, right? They've been working on that since day one. And so, but now we have that available, and it seems to work just as well as the mRNA vaccines, and time will tell. It also allows us to do some other things as well, because it doesn't require that cold storage. So that means we can get it out to places where people can't necessarily get it. And particularly in the developing world, if you want to go into sub-Saharan Africa where it's going to be really hot and you don't have a freezer, this is great. So we'll be able to vaccinate a lot more people. But as time goes on, we're going to learn even more. And as more and more people get vaccinated, then we can see what happens with the various groups and really develop strategies that will allow us to optimize our vaccine strategies.
And speaking of strategies, let me talk about treatments here now. And it's going to go to another question, but we had Regina Haley, who's a regular viewer of ours, asking, would monoclonal antibodies be better than Paxlovid because of possible rebound effects?
Yeah.
It's also like you're feeling better as well. So because in a way you had the rebound effect.
Oh, do I have a story to tell you, Regina? So I took Paxlovid, and I felt better. And at the end of my course, it was like a Saturday, and I felt pretty good. And I tested myself, and my antigen was negative. And then early that next week, my wife and I went to my sister's house in North Carolina for a family reunion, and I started feeling bad on the trip, and just achy and tired. I was coughing, but I kept attributing it to, it's just lingering effects from the COVID. And then finally, I felt so bad, I retested myself again, and my antigen was strongly positive. And so came home and felt terrible and lied on the sofa and didn't do much. And finally, I just said, I need to get the antibody infusion. So I went and I got the antibody infusion, and within about 2 days, I felt very much better. The real question is which should you do first? Okay. I would do it exactly the same way again, even having that experience. And that's because based on what we know, the Paxlovid works better than the antibodies on average. Okay. Remember, all of these things we're telling you are on average and doesn't really necessarily apply to a specific person. And so that's why it's important to talk to your doctor and try and figure all this stuff out. But there are people that are failing Paxlovid, and it happens in about 2 to 3, 4%. Although, as I hear stories, I wonder if it's higher than that, because both my wife and I had a rebound after Paxlovid. So that kind of makes me wonder what's going on there. But the antibody is, it in some ways it worked very well for me. I have a colleague who did the same thing. It worked very well for him. But I wouldn't put that first, because in terms of preventing death and hospitalization, it doesn't work as well. The other problem we're having with the antibodies right now is that we're in a tight supply. Right. And last week we thought we were going to run out, but we were able to get another shipment from the state. So, so if you call asking for an antibody infusion at UTMB, they're going to ask you a lot of hard questions. And if you don't answer them, they may tell you that you're not eligible for it. As the supply increases and the demand decreases, we open it up, and we don't quibble with people. But right now we're in a tight spot, and so we're really reserving it for those who are elderly, who have a lot of complications that would make them more likely to die from COVID, or who have had a rebound. So that we're doing it for that group as well.
And does that speak to, is it because so much focus went elsewhere, or that the monoclonal antibodies were at one time, at least one version of them were said, well, not as effective against this? Is that it's trying to find which ones work best?
Oh, yeah. I mean,
is that the big part of the supply chain, of the supply line right now?
Well, right now there's just the whole country's surging. And so the demand has gone up, and there's limited supply. And of course, the state of Texas gets it from the federal government, and the federal government sends it to where they think it's the most needed. And so we have seen this throughout the entire pandemic. We see the supplies go up and down. And so it sounds terrible that we sometimes restrict who can get it, but we've been playing this game all along. The other problem is that as the variants change, the effectiveness of the antibodies against a particular variant changes. So when we first started doing monoclonal antibodies, we had like 4 or 5 we could use. Now we're down to 1, and so that has also limited the supply.
Well, and that's the thing, is like at one point, then it's got to be okay, the multiples across the board, what needs to be there. Yeah. And how urgent that is, because you hear on a national discussion, not as much as a local, but a national discussion on a regular basis of we need to ramp up some stuff. That's where the government funding is needed to make that, because at this point that is the source of the funding, which goes into a question I was asked this week, particularly around COVID, is at what point do we no longer have our federal government or state government stepping up and doing this, but when do we start going into the private side of things, and insurance starts paying for it and the like, because that is nowhere near being worked out yet. Because it's been the focus has been here. As someone from the medical field, where do you see this going as far as the private side of this? Because just as we do, the norm is, yes, the startup of anything, there's going to be a lot of NIH funding, government funding, but then after a while, it gets handed off to the private sector.
Right.
How long do you think until we see that?
I think it's already happening. I mean, we've certainly seen that with, for example, the drug remdesivir. Remember, before that was approved, that was a gift from the federal government, and we did not charge anyone for that drug. But now it's been approved by the federal government, and so if you go into a hospital and get remdesivir, your insurance company will be billed for that. We're starting to see similar types of things with testing. And that insurance companies do pay for testing. So if you were to go to UTMB and you have insurance, your insurance, they're going to ask you for insurance.
I was saying that just happened to me for the first time. And,
yeah. And they're not trying to get the money from you. They want to get it from
the insurance company. Right. But there was not a deductible or anything like that. But it was for the first time they asked about, is your insurance still this? That's the first time I was asked during the testing, is your insurance still this company? I said, yeah. I said, why are you asking? And they pointed that out. And so that was an interesting standpoint of that there. Let's move on to the next one, because I think someone's trying to get a hold of you here urgently.
I don't know what that is.
That is actually your computer. Someone's sending you a message via your computer trying to get a hold of you.
Okay. So let me close everything, but
yeah, we'll let him do that while Dr. Keiser is figuring out how his computer works. Last chat we had, there was a probable case. Well, actually, you and I hadn't talked about it. This one, this came out earlier before, but the status of the probable case of monkeypox, Galveston County. It's called probable right now because it still needs CDC verification to happen. This is kind of, by a good comparison, kind of like the early days in COVID. Like, if someone came back, you thought, well, they may have COVID, you had to actually send the test sample off to CDC.
Yeah.
That was before UTMB was approved with one of the first they could test it themselves. Where are we on that case? We know it's a woman who was, from not from this area, that was then isolated. Where are we at right now?
Yeah. So basically, here's the process of what goes on. And it's one of these sort of Byzantine bureaucratic processes that we're trying to be able to get, to build some capacity so we can get around it. But basically, if you're a doctor and you see somebody you think has monkeypox, you call us up and you say, I got this person who thinks they have monkeypox. And so we go through and we have a list of criteria ahead of time that we look at and we say, yes, okay, let's go ahead and get a tester. Nah, probably not. And if we think it is all plausible, we will then call up the state and say, we have this case that we think is monkeypox. They've been very good. They haven't turned us down on any of the ones that we've sent so far because, we pre-screen them. And then got to get a swab, and you got to rub these lesions and then put it in a tube and somehow get it to a lab in Houston. And a lot of times what we'll do is the health department will go pick it up and take it there to make sure it gets sent. The lab in Houston runs the test, and they do what's called a presumptive test. And with that presumptive test, they will tell us whether it looks like it is monkeypox or it doesn't look like it's monkeypox. If it looks like it is monkeypox, then they send it off to the CDC, and the CDC does their confirmation test. And that can take a long time. Initially we were told that it would take about 7 days. In this particular case that we're monitoring, we still don't have that back. And it's been probably about 10 days now. Since we got that presumptive test back yet. So that's a problem. And I think the federal government recognizes that. And they've been pushing tests out to where there's a commercial lab, the Quest lab can do it. At UTMB at the Galveston National Lab, one of the investigators there also has a test, which again is only a presumptive test. And we've used that on several occasions, and it works very, very well. And he's able to get us a result back, literally within hours. Of sending it to him. So we're still in that same thing we saw before with COVID, where the testing network isn't there, but it is rapidly being developed. And hopefully within the next few weeks or so, we will see it even get more easy to get these tests back.
Because yesterday there was the confirmed case out of Brazoria County.
Yes, right.
Just to kind of give you that same process has been informed over there. is that was from several weeks ago. The
Yep.
probable case became confirmed yesterday.
Right.
Go along the lines you had mentioned, and then that was going to be my next question anyway. The National Lab at UTB Health, what's being done there to work on monkeypox? Because if anything, this type of thing flows into their wheelhouse, does it not?
Oh yeah, they're having a great time.
Not to make light of anything here,
No,
but,
not to make. Not to
this
make
is
light
what
of
they
anything.
do.
Yeah, but this is a good thing. Here we have this resource here in Galveston County where we have some of the best scientists in the world who can apply what they do to come up with practical solutions to help us right here, right now. And so it's, and they love being able to be helpful to us. And just as we love to be able to take advantage of their expertise and their availability. So, so there's already work being done on various testing mechanisms that can be done. There's one of my colleagues is working on something to actually measure monkeypox in the air. One of the big questions is that can it be spread through droplets, just like we talked about with COVID when it first started? The answer is we're not sure. And so he's got this device you can stick into a room with somebody with monkeypox, and it just kind of sucks the air through and filters it out, and then they take it, and then they can actually see if they can measure monkeypox in it. We've already developed a system to so that we're informing everybody about how to do the testing, how to make sure that it gets to us, and that we can make sure that the test gets done in a timely fashion. We've already developed pathways. If somebody with monkeypox happens to walk through the door, what do you do, right? We're working hard to get vaccine available. We've already have a little bit of vaccine at the health department that we use to vaccinate the close contact of that individual that had monkeypox. And we are getting pathways to develop to get drug to treat monkeypox if it's available. Again, these are all experimental therapies at this point, just like we experienced with COVID. The good thing about this is that what we're seeing is that the CDC and the FDA are being much more nimble and facile. So for example, last week, if you wanted to get the drug to treat monkeypox, it was a 19-page form. This week, they announced that that's way too much. We're knocking it down to 6 pages. Okay, all right, that's still a lot of stuff to do, but they have hotlines available. And so what we're seeing is in the state and in our region, and even on a federal level, everybody is working hard to get to a point where we can get ahead of it so that if we start seeing lots of cases, we'll be prepared.
At this point, who is at risk for monkeypox?
Yeah. So it's primarily being spread right now among men who have sex with men. It's not a sexually transmitted disease, like syphilis or gonorrhea or herpes. It really is intimate contact, kind of skin to skin. So even if you were to say share a bed with someone or potentially even hug somebody with monkeypox who had open lesions, you could potentially get it as well. But we're now beginning to see it spread out from that particular group. We've seen some women who now have monkeypox, and again, I'm not exactly sure how they've gotten it. Seen some kids out in California, not exactly sure how they got it as well. So it's working its way through various groups that we've seen, in our society, and just like we saw with COVID, where we had a very specific kind of group of person that we would look at. You had to be from China, and you had to, or have traveled from China or known somebody, all these things. But as time goes on, we're starting to see it get outside of that those demographic groups that we were initially worried about.
It's still, though, a low risk, is it not?
Oh, yeah. It's still very low risk. I mean, we're talking about hundreds of cases in the United States, thousands of cases worldwide. It's just that what we're seeing is that it just keeps climbing. So there's something there have been monkeypox outbreaks since the 70s. And typically what happens is you have an outbreak and everybody goes, monkeypox, and then it goes away.
But in most cases, it's stayed isolated in a particular area, and
most of it's been isolated.
Yeah,
it's been isolated in a particular area, but a lot of this is being traced back to a big festival that they've had in the Azores the Canary Islands for years and years and years and years. But something's different this year. And so a lot of people are thinking that maybe the virus has changed. And again, we've seen that before with COVID and other viruses, that makes it a little easier to transmit. So I can't say that we've gotten ahead of this yet, but everybody's working very, very hard to get us to a point where we can get ahead of this and put a stop to it.
Yesterday afternoon, Houston Mayor Sylvester Turner, Harris County health officials, and Houston health officials were, putting the word out about folks being careful. Also, working on getting more vaccines into the area. And vaccines right now are kind of targeted to specific areas where there's a higher infection rate. I don't want to say a high infection rate because by comparisons it's not. But something we talked about before we came on the air is if you had the smallpox vaccine, is it effective in protecting you in this case?
Yeah, it's probably pretty good. We don't know for sure, but everyone seems to believe that as these viruses are very, very closely related. And, they're both pox viruses. And so it expects that if you had a smallpox vaccine that you will not get it. So, it's one of the first things we did was that, if we have to send somebody out, we've identified people that have actually come from other countries where they were inoculated against smallpox vaccines. And they'll be the first ones that we send. And so as we get more vaccine in, we're going to vaccinate our public health nurses. We're going to vaccinate people who work in the STD clinic. We're going to keep a certain amount of vaccine so that if monkeypox shows up in a spot, we can vaccinate the close contacts around them, whether that be intimate contacts or household contacts. And then what we'll probably do as more vaccine comes in, we'll probably start inviting people from the public to get vaccinated. And particularly right now, that would be aimed at men who have sex with men. But as those demographics change, obviously those criteria will change as well.
And from monkeypox to something that just really shocked me to hear, I did not think I would hear in the United States. Also, particularly since I'm a Rotarian on that, polio. The first case of polio in the United States, confirmed case of polio in the United States in more than a decade. Came up in New York. Now, one of the things, what we do know about this patient is somebody who was not vaccinated for polio.
That's right.
That's one thing that has proven to work absolutely over the years. But there are more, and for the longest time, about the only cases of polio you saw were in Afghanistan. Which was one area that did not get the polio vaccine government control more than anything else. But should there be a concern here that even with just one person showing up not having the polio vaccine, that there's somehow a concern for others in the area? Just to give a reality check, because our country hasn't had to deal with polio in so long. There are plenty of people who are still alive who had it or had to deal with that before, Ben Raymer being one of them, by the way. But now, hearing that case in New York, granted, again, someone unvaccinated, can you just give us kind of, I guess, calming words on polio?
It's not at risk to the general population. Polio is one of those vaccines that you have to get to go to school. So almost everybody has gotten a polio vaccine. And interestingly, even among people that are fearful of vaccines and resistant to getting vaccines, polio vaccine has not been one that people have focused on. It's never been associated with autism, even though those studies are not particularly good. No one's kind of thrown any mud at it. And so in this particular case, what's the risk? Well, the risk is that this is in a community where there are a large group of people that are not vaccinated for religious reasons. And among those people, that if this guy has gotten polio and then he's walking around and excreting polio, then other people who are not vaccinated could get it from him. That being said, it's still going to be very circumscribed, and no one expects it to spread outside, that particular community in New York and upstate New York. And in fact, I think most people feel like they'd be shocked if there was even more than that one case, but it is still possible. So the risk is really very, very small. The other thing about this case that's very interesting is that he got infected with a form of polio that was actually derived from an old vaccine. So I don't know if you remember the sugar cubes.
Right.
And
I don't remember them, but I know of them. Right.
Yeah. Well, that's what I got. So But one of the dangers of that was a live attenuated vaccine. And so you would take the sugar cube and it would replicate in your body. It would give you an immune response. But, when you went to the bathroom, it could get the vaccine, this vaccine virus would be out there. And so over the years, this thing had mutated a little bit. And so it occasionally can infect non-immune people. Okay, so in the United States, that stopped. We stopped doing that to prevent that. But there still are some countries in Africa where they still use that live attenuated vaccine. And this case of polio has been traced back to that African strain. So again, the risk is not very high because, there's so many unlikely events that would have to happen. Someone would have to get that vaccine in sub-Saharan Africa, have to continue to shed it for a period of time, have to come to the United States, have to be somewhere where there were people who were not immune, and 90% of the people in the United States are immune, and then for it to go and get someone else. So again, I think when you add all those together, the risk to general population is very low.
Yeah, and I want to make sure we stress that again, but it's one of those things when you hear it, it's always somewhere
shocking,
else.
Right?
It caught my ear really fast as somebody who has over the years studied that extensively myself, and on committees I have served on within Rotary, which I was active for many years on. So it was just kind of shocking there. So, all right. Well, I know the one thing I will say, your phone's been going off, your computer's been going off, and you haven't noticed it, but people have been poking in through your door behind you here the whole time. I think some people want to talk to you. So I'm going to let you go here.
Hey, well, thank you.
We'll see you in a few weeks. Glad you're doing better. You have been watching What You Need to Know with Dr. Philip Keiser. We'll see you again in 2 weeks. I'm TJ Allens, I-45 now.
Hi, everyone. My name's Amy. I'm with Coastal Health and Wellness. I'm here to tell you about this year's Back to School Block Party. Coastal Health and Wellness, in partnership with Galveston County Health District and ARC Pet Allies, are partnering to throw the Back to School Block Party. It's on July 30th from 10 to 12 here in Texas City. We're offering free school supplies while they last, but remember to please bring your children to pick up these school supplies. We will also have free giveaways, prizes, raffles for free sports physicals, and much more. We'll also have resources like WIC, SNAP, and you'll be able to get registered for our clinic here at Coastal Health and Wellness for your primary care and dentist needs. All ages welcome. Please join us at 9850 Emmett F. Lowry Expressway, Saturday, July 30th for our Back to School Bash. If you need more information, visit us at coastalhw.org. See you then.